All right, welcome everyone, and thank you for joining us today for Rocky Mountain Institute's webinar, where we are sharing findings from our recent report on the health and air quality impacts of gas stoves, as well as discussing solutions to reduce fossil fuel combustion in our buildings. This event is brought to you thanks to RMI Solutions Council and Innovators Circle. So we are so grateful for all of our members who are able to join us today. Before I hand it over to all of our panelists, we'll get some introductions from them shortly. We will have a brief presentation, after which we will enter a panel discussion and audience Q&A. So just wanted to let everyone know that you can ask your questions anytime by entering them into your dashboard, your GoToWebinar dashboard, and we will get to those during the Q&A period. We may not get to all of them. We've got a lot on the table for our discussion today. So we will be sure to follow up with any questions that we were not able to answer live. So we will start with some brief introductions from our panel, and with that, I will hand it over to Jamie.
Great. Thank you, Kelly. I'm Jamie Mandel. I'm the Managing Director of our Buildings Program at Rocky Mountain Institute. Thank you guys all very much for joining the webinar and letting us talk to you about our recent research. I'm joined by Braid Seals, who's our health and air quality lead within the Buildings Program, and Jonathan Bonacore, who's a research scientist at Harvard, was a peer reviewer on this study and is also leading some future work that follows on from this that we'll talk about. Before I hand it over to them to talk about our gas stoves report, I wanted to just say a few things about why we're spending so much time on buildings, what air quality and health has to do with climate and other issues that we focus on, and where we feel RMI's role makes the most sense. So buildings are 40% of emissions when looked at collectively. That includes the materials, concrete and steel, that go into those buildings, the electricity use. In the US, buildings consume 75% of electricity, and direct fossil fuel combustion in the buildings themselves, which is 8 to 10% of emissions and one of the focuses of today. Buildings are a very personal thing. We spend 90% of our time inside buildings, and so indoor air quality, the air we breathe in those buildings, is critically important. And to date, we've mostly focused on buildings' impact on outdoor air quality, and more or less glossed over some of the impacts that indoor air quality can have. So we're really excited to share some of that research and its impacts today. Buildings also have a ton of co-benefits. They can impact lives, improve comfort, health, and productivity. I view buildings as really critical at the intersection of climate, health, and equity. Buildings have been a sustained focus for RMI since its inception. From back when we were helping to establish the LEED program at its infancy, to the retrofit of the Empire State Building over a decade ago now, and now some of our current work. The work we'll talk about today sits within our building electrification initiative, where we're focused on how we get fossil fuel combustion that's happening in buildings, out of buildings, and take advantage of a rapidly decarbonizing grid. Buildings have been around, we've been focused on them for a long time, but this next decade is critical. It is the critical decade if we're going to stay on a 1.5-degree trajectory. We need to decarbonize nearly half of the buildings in the US. And when we say decarbonize, we're looking at getting fossil fuel combustion, including gas, out of those buildings and powering them with a low carbon grid that's being developed at the same time. Next slide, Kelly. So why air quality and health? RMI is traditionally focused on energy and climate, but air quality sits at the center of health, of climate, of equitable outcomes, and is really critical to focus on. A report published last month found that outdoors air pollution is the greatest environmental risk factor for early death, leading to up to 100 to 200,000 deaths per year in the US from outdoor air pollution. Since the passage of the Clean Air Act, we've seen a decline in many sectors like transport, industry, and power, where we've had a focused regulatory effort. Building emissions, on the other hand, have largely been unregulated and now contribute a greater share of health impacts That's coming from a recent MIT study published in Nature, finding that buildings combustion, that's natural gas, that's wood, that's propane, to be the most important source to address, responsible for 37% of all early deaths from air pollution in 2018. The good news is that by electrifying and decarbonizing buildings, which has a positive climate outcome, we can also significantly reduce emissions and indoor air quality effects, both inside and outside. So we're really excited about the research we're starting to see and uncover about how this can support both rapid climate benefits, but also health and equitable outcomes. It's worth noting that the health effects of air pollution are borne disproportionately in lower income areas and people of color. And so we see this effort as a way to improve equitable outcomes in addition to health for everyone. Next slide. I'll just speak briefly about what we feel RMI's unique role in this space is. I think this report highlights some of the benefit that RMI can provide in a few unique ways. All of the research we talk about in this report are peer-reviewed studies that have been around for a period of time, but haven't been well communicated, haven't been taken up to support regulatory and policy outcomes, and haven't been integrated into changes that we'd like to see in the building industry as a whole. And so there's a really unique role that RMI can help to bridge the gap between the current and continuing to emerge research and the action that we need to see in the world to benefit all of us on this call, who I think are all largely taking this call from inside a building, as well as to support US climate goals. So thank you very much. I think without further ado, I'm going to turn it over to Brady.
Fantastic. Thank you, Jamie. I joined RMI in December after having spent about 11 years working internationally on clean cook stoves, so helping to transition from wood and charcoal to cleaner alternatives. And as I like to say, now completing the spectrum by helping to move from gas to electricity. So on the next slide, you'll see the front cover of the report that we published on May 5th, which is World Asthma Day, with 3 other organizations, Physicians for Social Responsibility, Mothers Out Front, and Sierra Club. So this was a collaborative effort to really address a gap on what are the health impacts from gas stove pollution. On the next slide is a brief summary. And what we did was we realized there's nearly 50 years of peer-reviewed studies from around the world that look at the health implications of cooking and being exposed to gas stove pollution. What we did was we focused on the last 2 decades, so the last 20 years of peer-reviewed evidence, and we synthesized hundreds and thousands of pages of research into 8 key findings, which you can see here and we'll talk about. We also wanted to highlight some cases of action where we're seeing progress on this. So in Canada, we've seen them strengthen their indoor and outdoor standards and guidelines to the strictest in the world because of this issue. We've seen movement in California, where now over 31 communities are addressing this issue from climate and health perspectives. And we've seen healthcare organizations like the Massachusetts Medical Society identify gas stoves as a trigger and move to take action from the healthcare professionals. And we've also looked at why this work really needs to happen in places where people are bearing the disproportionate burden of climate change and also the health impacts. So what we've done is we synthesized this and then we provided practical recommendations for policymakers, individuals, healthcare professionals, researchers, and funders. So this report itself is about 10 pages of text, and the rest is graphics and photos. When we were writing this, we realized that this report needed to be something that we could send to our moms, that they would want to read and get this information into the public domain. So it's about 10 pages of text and 20 pages of citations. Once again, this is an evidence and fact-forward report. On the next slide, I'll start to talk about some of the key findings. And as Jamie mentioned, we do spend 90% of our times indoors, even before these stay-at-home orders. And just to put that into perspective, we spend more time in buildings than some whales spend underwater. So certain whale species are coming up for air more often than we are leaving our buildings. So this is a significant amount of time. And the ironic part is that we are paying less attention to our air quality. Even the EPA states that our indoor air quality is often 2 to 5 and as much as 100 times as high as outdoor air pollution. And we're going to talk today about the gas stove. And this is an EPA statistic where they said that homes with gas stove pollutions have 50 to 400% higher nitrogen dioxide emissions than homes with electric stoves. So nitrogen dioxide is a toxic gas that comes from combustion or burning. Many of the pollutants, the criteria pollutants, or the 6 most common pollutants that come from our gas stove also come from our car exhaust. So it's not that these are necessarily different pollutants, but we just haven't paid them as much attention as we have to the outdoor sources. So in the next slide, we'll just look at what that means. So in the absence of federal standards, in the US, we do not have standards for indoor air quality, which again, we're spending 90% of our time indoors. So in the absence of these standards, we're benchmarking our indoor air quality against outdoor standards, where the EPA and also certain states have said, this is the threshold in which it is safe to be outside. For 1 hour, it is safe to be outside at a concentration of 100 parts per billion nitrogen dioxide. And a parts per billion, you can think of it, it's like 1 blade of grass on a football field or 1 drop of water in an Olympic-sized pool. So these are small fractions, but they have large health consequences. So we don't realize often that baking a cake in a gas oven may have a nitrogen dioxide spike of 230 parts per billion. Or as you can see here, turning your gas oven off with no food may have 130 to 546 nitrogen dioxide peak levels. And so this slide hopefully gives you an idea of where these differences are and why standards and guidelines are so critical for us to, number one, understand, and number two, address indoor air quality. Like I said, Canada has shown great leadership in 2015 in passing indoor guidelines that are much stricter, 90 parts per billion, and also outdoor guidelines for nitrogen dioxide that are 60 this year, and in 5 years will go down to 42%. And much of this, next slide please, we'll see is because we are learning much more about the harms of nitrogen dioxide, and children and lower income and people of color are often disproportionately affected by this. So one of the reasons why children are so susceptible to illnesses that are associated with air pollution is because they breathe much more than us. Children can breathe twice as much air as an adult. And for those of you who are home with children, I'm sure you recognize that they have much higher levels of physical activity and movement. And all of this affects their exposure. Also, children's lungs are developing until they're 6 years old. And so there's a critical time when we would want to try and reduce the amount of exposure and susceptibility that children are having to air pollution. On the next slide, we're talking a lot about nitrogen dioxide because that is one of the pollutants we can segregate out from gas stoves versus other pollutants inside the home. So cooking food and burning toast will produce volatile organic compounds and other such measures, but we can differentiate between cooking food and cooking with gas stoves and the source or the flames, if you will. And nitrogen dioxide is a pollutant that we're particularly concerned about because the evidence has been strengthening over time. In 2016, the EPA found that there is a causal relationship between nitrogen dioxide exposures and short doses and health effects. And our best evidence is among children. So we know that children living in a home with a gas stove globally have an increased risk of childhood asthma symptoms of 42% and an increased risk of being diagnosed with asthma 24%. So this has been around for a long time, but the evidence has been strengthening not only from the respiratory tract, but from others. There's cardiovascular effects, IQ and learning effects, changed lung function, and increased susceptibility to allergens. Next slide, please. The other population I want to talk about is lower income households who may be at a higher risk of exposure to gas stove pollution. There are a number of factors. Number one, a smaller unit size. A recent study from UCLA modeled concentrations of nitrogen dioxide during cooking events for single family homes, townhomes, and small apartments. And they found that in 90% of the cases, the outdoor 1 hour standard of 100 parts per billion was exceeded. But in the smallest of apartments, it was exceeded by 98% of the time. Additionally, more people living in a home increases the potential effects of this exposure. And then older homes with inadequate ventilation is also a main risk factor. Another one that's very notable is using the stove or the oven for supplemental heat in the winter. So you can imagine the levels that we talked about earlier with baking a cake. If you have your oven door open for all night or long hours, you can have a significant buildup of nitrogen dioxide, carbon monoxide, and some of the other pollutants. Additionally, one of the main factors for this gas stove pollution susceptibility is already having asthma or already having high exposures to outdoor pollution, which we know is correlated to greater risk of asthma. So this is really to say that a lot of this air pollution, all of this air pollution from nitrogen dioxide is in effect preventable. And we know what these risk factors are. And I think that there's more we can do to tease out some of these correlations, but for sure, the focusing on children and lower income households is where we'll see a greater benefit. Next slide. So it is a lot of information, and our intent is not to scare anyone about these facts. Somehow we've just gotten used to the fact that we have a combustion appliance in our home that is often unvented. And there are things that we can do that can reduce exposure. Many of these things cost nothing, and we can start right now. Number one is to install and maintain a carbon monoxide detector. We've talked a lot about nitrogen dioxide, but having a carbon monoxide detector, and particularly one that is at a lower level, most of the most common carbon monoxide detectors will not alert you at the levels in which we've seen health effects. And so that is an option, particularly if you have cardiovascular issues, underlying issues that could make you more susceptible to carbon monoxide pollution. The other piece is ventilation. And I just want to say here that seems a bit odd to me that our stoves are not sold always with the ventilation unit. It's a bit like buying a car and buying your seat belts separately, because our best chance if you have a gas stove to reduce exposure is to vent it. But in all states, it is not required to vent outdoors. Almost every other gas appliance in the home is required to be vented to the outdoors, except for the stove, where we spend most of our time standing and breathing in front of. And so many places do not have adequate ventilation, or like me, have a microwave unit above that recirculates the air inside the home. And so we need to have better standards on ventilation. There also is no standards for ventilation units for range hoods, which is also very I don't know, surprising. And so what we do know, though, is that if you have ventilation, we should be using it, but it's not a sole strategy. It's not a sole fix for reducing gas stove pollution. The other option is to open a window while cooking to diffuse these types of concentrations. Even for 5 minutes or less, that can make an impact. And then cooking on the back burners. We do have ventilation, there is much greater capture efficiency, so we're able to pull up the pollutants when they're on the back burners in front of the front burners. It's been an adjustment for me, but it is something that's recommended in almost every single peer-reviewed study. Using a plug-in electric appliance is another very good way to reduce gas stove pollution. So many of us at RMI have been using these during quarantine, and you can find them on Amazon for $50 or less. We've heard before that your pots and pans may not work, but if you can test them out by putting a magnet on the bottom, and if the magnet sticks, it will work on an induction stove. So trying a plug-in is a great option. And then ultimately, it's one thing to reduce your exposure, but it's another to remove the source of that exposure. So switching to an electric or induction stove will remove the nitrogen dioxide and the carbon monoxide emissions. We, of course, still believe in ventilation because cooking food, burning food, as you know, will produce pollutants. But there's something different in burning something and then turning on ventilation because you can see and smell the smoke, versus knowing that there's invisible, odorless pollution that happens when we cook. And so I think part of this is just being armed with the information to help make the best choices when deciding how and what to cook your meals with. Next slide, please. We've focused a lot on policymakers. We believe that health is a key driver for policymakers. A recent report that came out found that if we could just marry together the health impacts with the energy efficiency impacts of buildings, we could lock an additional $2 billion a year in federal funding for these types of initiatives. And so I think that this is really the power in talking about buildings, climate, energy, and health at the same time. So we put out some practical recommendation for policymakers, starting with setting these guidelines. We are flying blind if we don't have a good way to set safe thresholds. So we see that as a really key first step. Building codes, we're doing a lot of work on this in California that I'll talk about, but we need to be talking about ventilation and other protections for folks in the home, and we need to start paying better attention to indoor air quality. Warning labels, requiring manufacturers to warn consumers about the dangers of gas stove pollution. Many people just aren't aware. I myself, who have worked on stoves for 11 years, was not completely aware until I started doing the research. Additionally, we need our policymakers to provide the incentives to allow those who are most affected by this to switch. And this is a really key area that I just want to spend a minute talking about, because I feel that, when coming from my work globally, it is very hard for someone who is struggling to make ends meet to invest in something that may be considered expensive. And we know in this country as well that there is an energy burden that's placed on lower income households. So health is a policy driver, and I think that this is where we start to see what kinds of incentives for retrofits, for stove switching, et cetera, can come into play. And we don't want to put the burden on the individual, and we're working very hard to make sure that policymakers understand that there is a climate, economic, and health reason to electrify buildings. This is really crucial when you start talking about public buildings and landlords. It becomes tricky when you don't have control over your energy sources to make the best decisions. And so we are focusing a lot on two different efforts. One is public awareness and advocacy, and the other is real and tangible policy change. Next slide, please. So that's the report talking about driving impact. So this report, as of this year, besides the job openings page, it's been the most visited RMI webpage this year. And we've gotten 150 different media hits, and this is original articles and reprinted stories. You can see the logos on the right-hand side. It's across the spectrum of media outlets. And I think what this says is that there's an appetite for this information. There's an appetite for this knowledge and for having the facts and having the evidence. We had over 1,000 downloads in the first month, and a lot of what we've been doing over the last couple of weeks is stakeholder engagement. So we've briefed over 400 stakeholders directly and doing one-on-one briefings with key policymakers and different groups of policymakers. Next slide, please. So around the country, more than 1/3 of us cook with gas. The number is about 35% as a national average, but in certain places that number is much higher. So in California, for example, 70% of Californians cook with gas. And recent Lawrence Berkeley National Lab studies have found that 12 million Californians may be exposed to levels of nitrogen dioxide that would be illegal outdoors. So California is one place we're spending a lot of our time right now. Two different ways we think we can drive tangible, real action, starting with this report, is in the 2022 building code. So we have been working with them on ventilation standards, as I talked about before. California, I think, will be a leader in ventilation standards for range hoods and exhaust fans. And additionally, calling on policymakers for an all-electric 2022 building code. So most recently, we led an effort where we had over 42,000 health professionals sign on calling for the California Energy Commission to go all electric in 2022 because of health reasons. And this was 7 healthcare organizations. The nurses came out in full force in support of this. They're often the ones seeing children who have been experiencing asthma and then are sent back to a home with a gas stove. So there's a real need for this to be known more as an asthma trigger. Of course, it's not the only one, but it is a key one. And then the second piece in California is really working on setting these indoor air quality guidelines so that we can set better policy, model better policy. California is unique that it does have indoor air quality guidelines, but they have not been updated since 1994. And so there will be a workshop later on, and there's a lot of effort within California policymakers to make indoor air quality a priority. And I think part of this is driven by the fact that right now during the COVID pandemic, we can't ignore the linkage between air pollution and public health and some of those outcomes. And the California Air Resources Board, or CARB, is currently conducting a study to look at the susceptibility to COVID based on air pollution in California. So I think this is very timely. The other place we're spending a lot of time and where there's been much interest is in New York. We're in the process of building a coalition, and many of these are among the environmental justice communities who are feeling this every day and need more visibility into this issue, and also need the policy tools and incentives to allow real action to happen. And where we see RMI's role fitting in is a facilitation role, providing the resources and the tools necessary, and then also helping to quantify the health benefits of decarbonizing buildings in terms of indoor and outdoor pollution levels. Next slide, please. So we've talked a lot about indoor air pollution, but the outdoor health impacts from buildings is another key area which has been maybe not as well understood. And so Jonathan is probably one of the leading experts in this topic and is going to be here today to talk about what he's been working on for the last year. And I think this is just to say that buildings, it's an enormous problem, but we believe that it might be one of the easier sectors to solve when it comes to this. And in doing so, we will greatly impact public health, climate, and I think a strong focus on environmental justice will be critical. And that, I believe, is it. Thank you so much for your time and interest. We really appreciate it.
Excellent. Thank you, Brady. And I think I speak for a lot of us when I say that as we were looking at those statistics, we're all thinking about how much we cook on our own stoves in our homes right now. So thank you for that great perspective. So now I'm going to transition into some Q&A and panel discussion. And Jonathan, we would love to hear from you. We've heard so much about the adverse health effects of poor indoor air quality, but tell us a little bit more about your work on assessing the impacts of gas and building emissions more generally on outdoor emissions.
Yeah, so so thanks everybody for attending, and thanks for paying attention, and thanks to RMI and your supporters for helping to kind of make this webinar possible. So to talk a little bit about some of the work I've been doing related to gas and buildings, basically ended up embarking on this study to basically reconstruct sort of what's been going on with public health impacts of air pollution over the course of the last decade or so. I'm sure, as most people know, there's been a really big transition away from coal and to gas for the electricity sector. But on top of that, I wanted to capture as well anything going on in buildings and some of the industrial sector. So probably no surprises, is that we did find that a decade ago, coal-fired power plants was one of the biggest sources of public health impacts from air pollution. But over the course of the decade, you could see the drop in emissions and health burden from coal-fired power plants, and sort of After that's gone, the remaining leading sources was a really bizarre mix of some of the remaining coal-fired power plants, and then after that, the next leading sources were buildings and industrial sources fueled by a mixture of gas, wood, and biomass. And kind of the next leading source is, it really varies by states. I mean, there's some areas where it's gas in commercial buildings, other areas where it's wood burning in residences, and some areas where it's industrial boilers with biomass or wood. And kind of the leading fuel source differs depending on what source you're interested in and where you are.
Great, thank you. And Brady, as it relates to these recommendations that the report and the team is making, not only to individual homeowners or landlords or policymakers, where are we seeing the most traction so far and progress?
Thanks, Kelly. I would say in California, we're seeing a lot of direct policymaker progress. We've seen the California Air Resources Board talk about making indoor air quality a priority, and I know that they're hiring someone right now, and there's a lot of work to start to address this issue. So I would say on the policy level, I'd point to both the California Air Resources Board and the California Energy Commission with this process with the Title 24 or the building code process. This is a way in which we can use air quality and health impacts to make tangible and direct action on building codes. As we know, the buildings that we build tomorrow will last decades, if not generations. And the other place I would highlight again is in New York, where we're seeing environmental justice folks want to start working on this issue more from an advocacy and policy perspective. And then just a couple other ones I wanted to note is that utilities have a role to play. Two great examples I think come from California, the Silicon Valley and Sacramento, where the utilities have come up with induction stove lender programs where for 3 weeks for free, you can try out a plug-in induction stove and the pots and see what is it like to cook with magnets? What does it feel like? What's the experience like? And I think it's a really good entry point to take this new technology and show that it is just as good and even has some benefits to cooking with gas.
Great, thank you. And I think this next question, I'd love the perspective of all of our panelists, because I think everyone is so impacted personally and deeply. But you know, we're in the middle of a global pandemic, and how has the pandemic really changed or impacted the work that you're doing as it relates to the air quality and health effects of buildings? Jamie, I'll start with you, then we'll go to Jonathan and finally Brady.
Sure. Thank you, Kelly. I think the pandemic has made many of us, I think, rethink indoor air quality. We're spending even more, most likely than the 90% of our time indoors. Ventilation in buildings is critical. We're finding to preventing the transmission of COVID-19 indoors. And so both increasing ventilation levels pretty substantially and increasing the filtration or purification of that air somehow matters quite a bit. That can be very good for mitigating some of the health impacts from gas stoves and gas appliances if we do those things together. I think from a building design perspective and a building retrofit perspective, we're spending a lot more time thinking about safe levels of ventilation and safe levels of air filtration. And I think it's a perfect time for all of us personally, but also for policymakers to be looking at indoor air quality and what we can do to make sure that our homes are safe. I think one of the things we've learned is this is a safe space. We want and need our homes and our buildings to be a safe space for us when there are crises like this. And so it's a big opportunity. We bought our first plug-in induction stove last year, what Brady mentioned. And my wife has a small food company, and like she prefers it, right? But what we found is it's not only a safer experience, but it's actually in many ways a better, more controlled, more precision cooking experience. And that's I think the point that not only is this one of the biggest health and climate issues we need to confront, but it's also one that has solutions that can be bought on Amazon. Like that's a fantastic opportunity for us, and I think one that's really good.
Jonathan, what do you think?
Yeah, so no, definitely agree that with the pandemic, like everybody's been spending more time indoors, and I'm sure much more well aware of what's going on inside your own homes. And it's definitely refocused some attention on what the indoor exposure is, what indoor exposures are. Um, but I think one of the other things that kind of this pandemic has highlighted, among so many other hazards, it falls again on sort of racial, ethnic, and sort of socioeconomic status lines. So again, similar to so many other things, again, Black uh, people of color tend to be more affected by the pandemic, have been more affected by these other environmental justice issues. And I think, again, this is one of many instances where sort of what you need to do to kind of repair those injustices also lines up with a good solution to meet your climate goals.
Great, Brady.
Yes, I agree with both of those. What I would add is that I think it has brought out an increased interest in measuring indoor air quality. You know, once you learn about some of these things, it's very hard to unsee them. And so I think that there's going to be an increased understanding on how do we measure. So for example, how do we measure a retrofit building before and after, and then how do we quantify that, and how can policymakers use this to better capture these co-benefits? Right now, we're assuming the indoor air quality impacts are zero because we don't have good ways to quantify them. So I think we will see more effort placed in that, and I'm excited about those pieces. And then I would just really echo what Jonathan's saying is targeted interventions in places where people are already affected by air pollution. This is preventable. Air pollution is a preventable, which is why I spent my career working on it. They're tangible solutions. And so our job is to help figure out what are the regulatory pathways to help make this a possibility.
Great. And I think building on that, and this is actually a question that was posed by a member of our audience, when we see programs that are run by utilities, when we see policies that are passed at the state or even national level, health and equity are very rarely front and center in that decision making. So maybe I'll start with Jonathan. What do you feel is the unique value of this type of research in placing safety and equity at the forefront of a lot of these policy decisions? And do you feel like, you know, maybe as when business as usual is no longer an option, do you feel that this will become a greater consideration in these types of policies and programs?
Yeah, definitely. And I'd say that's kind of been a trend probably for the last decade or so. I mean, some of my first research was on health benefits of climate policy, and the field has kind of really grown rapidly since then. Again, because I mean, nobody ever makes a decision in a vacuum. You want, if it's a climate policy, like you also want to be able to demonstrate that there are health benefits and benefits to environmental justice communities, just because, again, policymakers and many others are juggling many different kind of endpoints and goals at once. And you know, different things are kind of top of mind depending on current events. So being able to bring in the kind of evidence that, you know, given intervention is good for climate, good for health, good for environmental justice, very useful for the policymakers in terms of making a case for that intervention. And in addition, I mean, in the political arena, it's a good way to really kind of build a larger coalition around these kinds of actions. And, you know, if you can get sort of the folks very concerned about climate kind of conjoined with people who are concerned about environmental justice and those kinds of things, it's a much larger coalition that can do a lot more to kind of advocate for these solutions.
Excellent. And a few questions have come in about guidelines or tips for building new homes or remodeling a home. So Brady, you mentioned that, you know, investing properly with, you know, new buildings that are going to be around for 30 plus years. What sort of resources can we point people toward that would be sort of a go-to set of guidelines for new construction or a home remodel that is powered with clean electricity rather than gas?
Yeah, that's a great question. In fact, a group out of California called Redwood Energy, I just saw they put together a YouTube channel with 48 different videos on how to DIY or do it yourself to go into an all electric home, and part of that is installing a new induction cook stoves. I think induction, it's so popular in Europe and China and other places where it's just run of the mill, but here in the US there is still, I think, a bit of learning to be done, and there haven't been great resources. I think probably half of my inbox is people asking me what model induction plug-in or stove should I buy. And so I think that that's one place where we're going to see more of, to find some buying guides and some frequently asked questions. Will this induction stove be compatible with my electrical socket and things like that. So I think on the cooking front, we'll see more of it. There are some resources, and in California, the Building Decarbonization Group has compiled quite a few. In terms of new construction, I think that this is where we're seeing in the Title 24 process in California, the building code, can we come up with something that could be an example for other states? And I will say that on the question on guidelines and standards, it has been very challenging to figure out in each state who has the authority to set indoor air quality guidelines. It's a black hole, even the policymakers that you think would be responsible. So that is what we feel like part of our job, to help have the policymakers be aware. And then also on the utility side, there is excellent rebate programs around the country for heat pumps. In California, there's one where you can get a heat pump with only paying $200 because of the amount of rebates that have been there. Maine has an excellent heat pump program. And so I would say that I hope in the future we see that for appliances that can really impact indoor air quality. Jamie, is there anything else that you would say on the building side?
I would just say a couple things, Brady. Thank you. So one thing we found is that for 98% of the people in the US, electrifying your home today already has carbon benefits. So this isn't something that you need to wait on. It's for appliances, right? It's your stove, it's your water heater, it's a clothes dryer if you have a gas clothes dryer, and it's your furnace. And for all of those, there are effective all electric alternatives. A building that meets current building codes will be efficient enough, even in cold climates, with a cold climate heat pump to meet your needs on the furnace. So that all exists today. I think the other thing I'd add is you do increase your electrical consumption when you electrify all of these. I know many folks are also considering electric cars at the same time. And I think a couple things to think about are, depending which you start with, either your transportation or the appliances in your home, make sure to upgrade your electrical. If you need to upgrade your electrical panel, you can do it once for both sets of initiatives and be in good stead. I think another opportunity a lot of people consider at the same time is rooftop solar, if they're lucky enough to have a south-facing rooftop without shading.
Excellent. And it sounds like the research that you guys have been involved in is literally just the tip of the iceberg in terms of quantifying the health equity or even environmental impacts of lowering gas use in homes, both for indoor and outdoor air quality. Jonathan, can you tell us a little bit about where you see some of the biggest gaps in research and what you have planned next?
Yeah, there's a lot. As far as gas goes, kind of the way that I think about it is, one of the first papers that I wrote was this big paper. We called it the true cost of coal, that basically collected, collated like all of the health, climate, and environmental impacts of using coal, all the way from the coal mine through transportation to combustion to waste disposal, doing as well as we could, kind of quantifying and monetizing the cost of those that we could. That would, to me, that's a very good research goal to get to with gas. And again, with that coal paper, it ended up being the foundation of the Sierra Club's Beyond Coal campaign, and that kind of evidence was used for all sorts of different policy actions, different advocacy campaigns, and that kind of thing. And it was, turns out, fairly fundamental. So I'd like to be able to replicate that with gas. but since at this point in time now, there's a lot less research on gas than there was on coal at the time. So there's a lot of kind of gaps to be filled in. And kind of going again down the supply chain, like we know at the wellhead, there's again evidence if for people living within a mile or 2 or 3 of these wells, you can see all kinds of different health impacts from like respiratory irritation to like birth defects and even childhood leukemia, folks living close to these wells. There's methane leaks, evidence of water contamination, harm to livestock if it's in a farming area, and all kinds of different kind of environmental impacts, land use, many others. Starting from there, you have sort of the pipelines and the compressor stations. The pipelines use a lot of land. Compressor stations, usually they're burning either gas or diesel to maintain pressure in the pipeline. And since they're burning gas or diesel, they emit NOx, SO2, PM 2.5, lead to ozone PM. Respiratory effects common with any kind of fossil fuel combustion. There's, again, land use along the larger pipelines. There's leaks in the pipelines. Something like 10 to 20% of gas in the US ends up going back underground into underground gas storage facilities. Did a paper on these a few years ago in response to the Aliso Canyon leak that I'm sure many people are aware of, where there's this big leak at one of these facilities just outside Los Angeles. The whole area had to be evacuated. There were people getting like nosebleeds, nausea, all kinds of weird health effects from that. And we found that the majority of these wells that serve these facilities don't have safety valves and really aren't built for storage, which is how this accident at Aliso Canyon happened in the first place. And then from there, if it goes to storage, it'll leave storage eventually. Again, there's leakage along the pipeline to get to the distribution center. There's the health, and then at the end use, there's these health impacts of combustion, which we have some information on. Again, the work that I did, and it's under review right now, focuses on PM. So it doesn't include ozone, doesn't include close range health impacts of like BTEX or any of the other compounds that can get emitted from power plants and industrial use. And in heating, again, there's emissions in buildings. There's a big gap as far as like what the exposures are indoors when you're using your stove. And I guess the piece that I missed in there is there's also, at least on the East Coast of the US, there's a lot of leaks in the gas distribution system in cities. So it's pretty common to be walking around and smell gas. And we don't have a good picture of the full contaminants of the gas. So alongside the methane, there might be other compounds in there that we'd be worried about from a health standpoint. I think that's it.
Great, so there's a lot to unpack there. And what timeline do you think this research will be? You said it's under peer review. What are we looking at timeline-wise?
Well, the paper looking at the combustion impacts is under review right now. That's going to take as long as it's going to take, probably a month or 2 or 3, probably 2, maybe 1. There's other work that I'm working on looking at regional air pollution from the supply side. There's some work going on trying to answer this question about other chemicals in the gas. But a lot of this other work hasn't even gotten started yet. Looking at the land use impacts, looking at, we don't know very much about water, and nothing's really been done yet to sort of look at this across the life cycle and really do a good kind of gap analysis to figure out what it is that we don't know.
Great, so much more to come.
Yeah, it's a career's worth.
Well, the next few questions actually relate to the sort of the supply chain side and the customer demand side. So our first question, I'll pose this as a 2-part question. The first question is around if you would prefer to shop locally instead of shopping on Amazon. I love this question. Do local hardware stores or kitchen stores, is there, is your average store well stocked with these type of electric appliances? Are the salespeople knowledgeable if this is a solution that you do want to inquire into? And then I guess the second part of that question is, are we finding that there's ample demand? What are some of those demand pulls? Because, you know, whether it's top line chefs or the home cook, gas is still sort of stood up as that preferred method for cooking. So maybe we could reflect a little bit on what do we think are some of the biggest demand drivers in these electric appliances? And then on the supply side, is the supply chain or our stores and retailers really set up to provide those appliances at a greater scale? Brady, you look eager to answer this one. Maybe we'll start with you.
I was trying to remember the last time I was at a store talking to someone, but I think that's a really, really great question. And it's jogging a lot of things in my mind that is a place where I think we can do more work. Part of this is that we're cooking with magnets now, and so I feel like there is some education that has to go along with that. Like, you can use many of your pots and pans, your cast iron will work, etc. It isn't, you know, you can have a pacemaker and work with it. That doesn't give any more radiation than a microwave or anything else. So I think that there is a lot that we can do to just educate both the sellers. I love that idea of shopping locally. I will look into that. Maybe that's one, Kelly, we can send around afterwards. And then on the demand side, I think that question about chefs is really interesting. You know, many commercial kitchens do cook with induction because they have often stricter ventilation requirements, and they have the types of standards that we don't necessarily have inside of our homes. And I know a couple of key chefs, like the Frontera, are huge induction proponents. One, because it's a lot safer. It's also, there's a lot of just easier to clean, easier to maintain, things like that. And so I think part of this will be this public awareness and the advocacy. My sense is that generally induction isn't as well known. And when people think of electric stoves, they're often thinking of those electric coil stoves, whereas the smooth top and induction, I think, is a whole nother experience. And that's where some of this comparison comes into play. But I also think that the induction stove makers need to be spending a little bit more money on marketing. There was a great article in Mother Jones about the influencers and the gas industry, and how are we getting our information. And so I think that there's an opportunity there for the manufacturers to get a little bit creative with reaching a mass audience.
Yeah, and I was just going to add to the point of there being a lot of surprises with the gas industry and safety issues. Folks in New England will probably remember about 2 years ago, there was a big overpressurization event in the Merrimack Valley where something went wrong at kind of the joint between the intermediate pressure kind of regional transmission line and the local distribution center for gas. Where basically the pressure was not being stepped down properly to distribution levels. So a lot of people, in the words of somebody that I work with, there was 50 pounds of gas going through a pipe designed for about a half pound. So a lot of houses caught fire, like 11,000 people had to evacuate, and there was a big push to kind of get the neighborhood basically back up and running, because this was in September, so winter was coming on. One of the things that ended up happening, there were some folks that I work with who were involved in the relief efforts, and IKEA was kind enough to donate a whole bunch of induction cook stoves for the community, because just they didn't have gas service, because the company had to replace all the gas lines. And they were doing it on the basis of safety and just getting this community the ability to kind of cook for themselves when they didn't have gas, which they relied on.
Kelly, I was just going to quickly make, I think, one more point, which is to draw some parallels with LED lighting, which is a transition that we've gone through over the last decade that had a similar journey. People are really attached, or have been, certainly, to incandescent bulbs in much the same way that people can be attached to gas stoves. And there are things we can learn from that effort, including midstreaming incentives, so that stores have an incentive to carry them and to see an attractive price at the point of purchase rather than through rebates later. So that's a utility program opportunity we can follow. And then the availability definitely depends kind of where you are and which shops you're going to, but increased education, utility program design that supports induction stoves like midstream incentives and sort of following that playbook that we've learned from the LED light bulb industry, I think is a great opportunity. And hopefully everyone listening has LED light bulbs in their homes. If you don't, it's a sub 1 year payback. The light quality is excellent.
Great. And I think we have time for just sort of one more final thought and reflection from all of our panelists. We had some great questions. Again, apologies we couldn't get to all of them, but I think we got to most, and we look forward to following up with some of you. But if you were to leave our audience here with one final thought or reflection or takeaway, what would that be? And Jonathan, we'll start with you, then go to Brady, then Jamie.
Yeah, yeah. I think I kind of said it before, but just to kind of reiterate, there's nobody in the world makes a decision in a vacuum. So really having information on health, on equity, on environmental justice is really crucial for any of these kind of wider societal decisions. Again, just because not everybody has climate top of mind. And it's really important to have the evidence, because there's a lot of people who actually need that evidence for evidence to support their decision making. And I think that's one of the big roles that research can have in this space, whether it's kind of modeling the effects of policies or trying to evaluate different pilot studies where people try these different interventions, like deploying the induction cook stoves or something like that, to actually measure, quantify, document any health and other environmental benefits that take place. And again, as far as public health practice goes, like when you do an intervention like that, like you have to document it and produce evidence, and then from there you can scale up.
For me, I would go back to what Jamie talked about earlier. I really think that air pollution is like this golden braid, and it combines climate, health, and equity. And I think that's a powerful metaphor, if you will, because in our own decisions, certain things motivate us. So what may motivate you to go all electric in your home or switch to an induction? It may be climate, it may be economics, and it may be health. And I think that same is true for policymakers. And so as you go and breathe clean air and spend time at home, I would just keep in mind this idea of this golden braid and how air quality is tied to so much of what we do. And in thinking about personal consumer decisions and policy decisions, knowing what to pull when to make the change that's going to bring us to a 1.5 degree scenario in the next 10 years. I think it's a critical decade. And I've been trying to think about that myself in my own decisions and my work decisions.
Yeah, I think I echo what Brady and Jonathan have both said. We're going towards a 1.5 degree future. This is the critical decade to accomplish that. We need to achieve 50% decarbonization economy-wide to achieve this decade by 2030 to be on track for a 1.5 degree future, which is a daunting target. And at RMI, we've always believed that a low carbon future is one that is better, it is lower cost, it is healthier, it provides a better outcome. And this is a perfect example, the building electrification space, where we're seeing health impacts and climate impacts come together in a way that's it's just a better outcome, and it's one that, unlike many of the actions we take, there's a personal action opportunity for all of us to make our own decisions in addition to pushing for policy.
Excellent. Thank you to all of you. And as I hear you all speak, I'll offer my reflection that since the 70s, Amory Lovins, our co-founder, stated that whether you care about environment, economic prosperity, or national security, you will do the same thing about energy. And I'm very grateful to the work all of you are doing for expanding that set of values also to health and wellness, as well as social equity. So thank you for all the great work you're doing. It's time to wrap up, and we so appreciate everyone's time today. Thanks to everyone for joining us on today's event, and we look forward to seeing you at future RMI webinars. So we look forward to seeing you next time, and we'll be distributing a recording of this call shortly after it closes. So stay healthy, stay safe, and thank you everyone for your support.
Thank you all.